This is special COVID-19 coverage on Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal.
And welcome to the very first episode of our special COVID-19 coverage, part of the Your Health podcast series at CSWestCentral.ca and all your favorite podcast platforms. I'm your host, Sean McMahon. Hoping that you're keeping well during these difficult times, but let's face it, it's understandable to have lots of questions and concerns these days. That's what we'll do our best to address as we kick off our special coverage. Not only that, though, we'll dive deeper into the many corners of CS West Central Montreal to bring you the best stories of courage, dedication, and hope. And that brings us to our very first guest, well-respected doctor at Berman Jewish Eldercare Centre, also director of the Herzl Family Practice Centre at the Jewish General Hospital, wrote to us just the other day to say that it had been the proudest he had ever been as a physician there at the Berman Jewish Eldercare Centre over the last 13 years. Welcome inside the Your Health podcast, Dr. Mark Karanofsky.
Hello. Good afternoon.
Nice to have you joining us. Before we get into the moments that prompted you to write us, can you tell us a little bit more about the Berman Jewish Eldercare Centre, which is more affectionately known as JEC, of course?
Yeah, so the Jewish Eldercare Centre is one of the two largest long-term care facilities we have in our CUS, and it's a building of 320 residents where people who are no longer able to live at home come and live at this center. It is a nursing home, and it is something that is a very integral part of our healthcare system for those who can no longer live at home.
I mean, listen, in the face of this whole COVID-19 pandemic that we're all dealing with, some extraordinary measures have been put in place across the board with the safety of everybody in mind. What was different about your last visit to your patients and residents?
So Jewish Eldercare is a place where my patients are actually not even patients, they're residents, they live there. And so it's a normal place where you would have lots of family caregivers come in to visit. And because of this whole situation, the government has imposed new rules that actually require people to stay away from these centers. And so for the first time in 13 years, I walked in and I was just only able to see staff and the residents there, which is definitely a big change from what we normally do. But that being said, I got to say, the staff really made sure that the patients and the residents were so comfortable and cared for and really in good spirits.
You know, I'm sitting here and I'm trying to put myself in the place of these residents. And obviously, it can't be easy to have quite a change in routine like this. What would you say from what you could see and hear? What was the mood like for the residents overall? Were they concerned? Were they talking about how they felt about all this? What was your take on that?
So the residents themselves seemed very calm and cool. I mean, the staff did an amazing job of not bringing what's going on in the outside world onto the inside. And it was all hands on deck, and everybody made sure everybody was well cared for and taken care of. I got there at around 8 o'clock in the morning, and by 9:30, 10, everybody had had breakfast. Everybody was up in their chairs and dressed. And the residents were in the front of the nursing station so they could see and talk to each other. And it was something that was actually quite sweet to see, and people were calm. And I think that was the most important thing, that nobody was nervous, nobody was anxious. I think the most nervous thing everybody saw was the news on the TV, so we tried to put on something that was a little bit more reassuring.
We're chatting with Dr. Mark Karanofsky, physician at the Berman Jewish Eldercare Centre, a long-term care facility within CS West Central Montreal. And with a place like JEC, with so many factors to consider at a time like this, obviously not a decision that was taken lightly, and some may not embrace it, but can you please express to us just how important it is to be restricting access to family and companions at this time?
I think that's a very, very, very important point to go over. Every time we think of what can we do to prevent things bad from happening to these residents, it's the exposure to this virus. This virus makes it into the building, and it could be disastrous for many, many patients. And so anything we can do to reduce their risk of catching this virus is something that's definitely our most important decision and ethical choice. And so the way I look at it is if there's 320 people at Jewish Eldercare, if everybody only has just had two people visit every week, that's 640 more opportunities to bring the virus into the building. And anything we can do to keep that number as low as humanly possible is what will allow us to decrease the risk and to save as many lives as possible.
It's amazing the kind of perspective you get when you start to hear the numbers and the scope of it all. For folks listening right now, I'm just curious, and I'll include myself in this. People with elderly parents or other family members who aren't necessarily in long-term care, do you have a little bit of best advice on how to protect those that are the most vulnerable individuals right now?
So I think hearing from the government and public health authorities and seeing what we're doing within the community, I think the most important thing is to isolate ourselves as much as possible from contact. And so for those over 70 or those with chronic medical conditions, they really should be staying at home by themselves. And they can have things delivered to their door, wipe it down before they bring it in. But my advice would be is, at least for the next little while, stay away from as many people as possible and avoid direct contact. Isolating those that are at the highest risk, I think, is the safest and most important thing we can do to protect our community.
It's great advice, Dr. Mark Karanofsky. Thanks so much for all the insight. Thanks for being so candid. Thanks for taking us inside, giving us a look at what you do on a daily basis. And thanks especially for being our very first guest as we launch into this special COVID-19 coverage on the Your Health podcast. Be well. Thanks for doing all you do.
Thank you very much. Have a good day.
You've been listening to special COVID-19 coverage on Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal. Don't forget to subscribe at CIUSwestcentral.ca/podcast or on your favorite podcast platform.